Hi, I'm Dr. Summers with the University of Utah Men's Health Group, and I wanted to talk a little more today about medical management of BPH or prostate enlargement. There are several different medications we use commonly to treat BPH. The most common of those medications, it falls under a category of alpha blockers. The prototype of this medication is tamsulosin or Flomax. It works on the 1-alpha receptor in the prostate and bladder neck. Interestingly, as a man ages, the number of these receptors increases, and so you get and this explains partially the worsening of symptoms as a man ages. With agonistic activity of these receptors, you get more increased smooth muscle action, and thereby you limit or constrict the flow of urine from the bladder out through the urethra. And so if you can block this smooth muscle, you can improve flow, and that's really the way that Flomax works. It's appropriate first-line medical therapy. It has few side effects, but I think it's important to note some of those side effects. The most common side effect is the feeling of dizziness or lightheadedness, and that occurs most often when a person goes from sitting or lying down to standing. This typically improves with time. Additionally, other symptoms can include low blood pressure and sexual side effects. The most common of those sexual side effects is retrograde ejaculation, which is when you orgasm, instead of having the ejaculate go forward and be expelled out the end of the penis, it goes backwards into the bladder. This often does not interfere with sensation, but it can pose problems with fertility. A second medication that is used, and we've discussed elsewhere on this channel, is that of 5-alpha reductase inhibitors. The prototype of this drug is finasteride or Proscar. Another common drug is dutasteride or Avodart. These medications are used to actually shrink the prostate and are also used in men to prevent hair loss. They are known to reduce the prostate volume by about 20 to 25%. They can improve your flow by about 10% and help reduce some of the symptoms that we described earlier by about 25%. Over time, they can reduce the progression of the disease and reduce your risk of needing surgery by about half. And an important thing to note while taking these medications is they do reduce your PSA, or your prostate-specific antigen. So your doctor needs to know that you're on these medications when he or she is monitoring your PSA, so they can take that into account. There has been some controversy about 5-alpha reductase inhibitor discontinuation syndrome or post-finasteride syndrome, and I'd encourage you to look at our information on this channel regarding that. These medications do have some rare side effects. They can cause erectile dysfunction. They can cause a decreased libido. Rarely men can have breast tenderness with these medications. And there have been some studies which have shown a link with an increased risk of prostate cancer. Most often that is explained by the fact that you're reducing the prostate volume and you're thereby improving your ability to detect prostate cancer as opposed to causing prostate cancer in and of themselves. However, that is a black box warning with these medications. There are a couple great studies which show using these medications in combination can greatly reduce your urinary symptoms, more so than either of those medications alone. Final couple categories of medications I'll mention briefly. One is an anticholinergic. Anticholinergic medications, there are several of these: oxybutynin, tolterodine, trospium, darafenicin, etc. They all work by inhibiting muscle contraction in the bladder, and so it really works to reduce the urinary frequency urgency symptoms. You're doing little to treat that actual obstruction, and they need to be used with caution as they can lead to urinary retention or the inability to urinate and empty the bladder. A final class of medications that rarely are used for lower urinary tract symptoms include phosphodiesterase inhibitors. The only drug with this indication is Cialis. Cialis or tadalafil has a long half-life, and in men taking that, it has been shown to improve some of those lower urinary tract symptoms when taken daily. This medication works great as combination therapy if a person suffers from erectile dysfunction as well as lower urinary tract symptoms or prostate enlargement. However, it can sometimes be cost prohibitive depending on your insurance. Thank you. We'll talk to you later.